Here's something that should alarm every parent in America. The very committee responsible for deciding which vaccines your children receive is being quietly packed with people who fundamentally distrust vaccines themselves. This Monday, federal health officials announced that 5 fresh faces will be joining the Advisory Committee on Immunization Practices, ACIP, the powerful group that advises the Centers for Disease Control and Prevention on vaccine policy. But here's where it gets controversial. These aren't your typical vaccine experts with decades of immunization research under their belts. Instead, many of these newcomers have spent years publicly questioning the safety and effectiveness of vaccines, particularly those designed to combat COVID-19. Let me break down what ACIP actually does, because this matters more than you might think. When this committee makes recommendations about vaccines, those decisions ripple through the entire healthcare system. Insurance companies use their guidance to determine coverage. The Federal Vaccines for Children program relies on their recommendations to provide free shots to families who can't afford them. Essentially, if ACIP doesn't endorse a vaccine, millions of families could lose access to it entirely. The timing of these appointments has public health experts genuinely worried. Dr. Tara Smith, an epidemiology professor at Kent State University's College of Public Health, didn't mince words when she observed that these individuals appear to have been selected not for their deep vaccination expertise, but specifically because they've been outspoken critics of vaccines, especially COVID shots. She expressed serious concerns that they'll use their new positions to further limit vaccine accessibility. But this is the part most people miss. We're not just talking about abstract policy debates here. Jessica Steyer, a public health scientist and founder of Unbiased Science, points out that the consequences of these decisions will be immediate and tangible. Measles outbreaks are already happening across the country right now. Respiratory virus season is approaching fast. Any policy changes based on misinterpreted or cherry-picked data will have real-world health consequences for real families. What makes this situation even more alarming is the systematic nature of what's happening. This isn't about replacing 1 or 2 committee members. It's about the wholesale replacement of career vaccine experts with appointees who have publicly challenged established vaccine science. Steyer emphasizes that even if these new members ultimately vote in favor of certain vaccines, enormous damage is being done simply through these public displays of vaccine skepticism and anti-vaccine messaging. And here's what should really get your attention. This Thursday and Friday, ACIP is scheduled to vote on 3 critical vaccines. We're talking about the measles, mumps, rubella, and chickenpox combination vaccine, the hepatitis B shot given to newborns, and COVID vaccines. The outcomes of these votes could dramatically reshape vaccine policy in America. Let me give you a concrete example of what's at stake. According to former CDC vaccination officials, the hepatitis B vaccine recommendation might get pushed back from birth all the way to 4 years of age. This might sound like a minor administrative change, but it's not. The hepatitis B virus has dropped by an incredible 99% among young people, specifically because we vaccinate babies at birth. If we stop doing that, we could see this dangerous virus start spreading again in significant numbers. Steyer warns that we should expect these new committee members to present unverified reports from the Vaccine Adverse Event Reporting System, VAERS, as if they represent confirmed vaccine deaths. To put this in perspective, she compares this tactic to treating every single 911 call as definitive proof that a crime occurred, which obviously makes no sense when you think about it. So who exactly are these new appointees? Let me walk you through their backgrounds, because their histories reveal a clear pattern. Catherine Stein serves as a professor in the Population and Quantitative Health Sciences Department at Case Western Reserve University School of Medicine. Back in January 2021, she wrote something that should raise eyebrows. She argued that Jesus Christ didn't fear lepers or practice social distancing. and that Christians should follow his example by rejecting COVID precautions. She described face masks as harmful symbols of fear, despite overwhelming scientific evidence to the contrary. She also claimed that COVID wasn't the dangerous killer that media and government portrayed it to be, even while deadly waves were ravaging the country. But here's what makes Stein's appointment particularly concerning. In her personal time, she's worked as a researcher for Health Freedom Ohio, an anti-vaccine organization that's directly aligned with Children's Health Defense. That's the same anti-vaccine group previously led by Robert F. Kennedy Jr., who now happens to head the entire Department of Health and Human Services. In February 2020, Stein even signed onto a letter urging then-President Trump to re-examine school vaccine mandates and focus on ending what she called the persecution of unvaccinated people of faith. Then there's Kirk Milhoan, a pediatric cardiologist who has actively campaigned against COVID vaccines due to the extremely rare possibility of myocarditis or heart inflammation. He's told reporters that we should completely stop COVID vaccination and conduct more testing before moving forward. Milhoan works as a senior fellow at the Independent Medical Alliance, which used to be called the Frontline COVID-19 Critical Care Alliance, a group known for promoting ineffective and often dangerous ivermectin treatments for COVID. The Hawaii Medical Board actually filed complaints and challenged his medical license, though he ultimately kept it. Evelyn Griffin represents another troubling appointment. Once an obstetrician and gynecologist who transitioned into holistic health, she's implied at public events that vaccines are fundamentally unsafe. At a Louisiana Health Freedom Day event in May 2024, she criticized other doctors for blindly believing COVID vaccines caused no harm, claiming that medical schools simply teach doctors to memorize vaccine schedules without questioning their safety. Griffin has participated in Stop Vax Passports webinars, sharing her experiences treating what she calls post-injection women and discussing her efforts to defeat vaccine mandates for Louisiana children. Hillary Blackburn, who happens to be the daughter-in-law of Senator Marsha Blackburn, works as a pharmacist and has recently suggested that vaccines might trigger autoimmune problems. The fifth appointee, Raymond Pollack, is a transplant surgeon about whom very little public information is available. Now here's the broader context that should concern everyone. These 5 new members will be joining 8 others that Kennedy handpicked back in June, right after he made the unprecedented decision to fire all 17 previous advisors. A research group called the Evidence Collective has already documented more than 50 false statements made during the first meeting of Kennedy's newly assembled ACIP group. The vaccine committee is authorized to have up to 19 members total, which means there are still 6 additional spots that could be filled. Under normal circumstances, the vetting and training process for new ACIP advisors takes months or even years. The rushed timeline here is yet another red flag. So what does all this mean for you and your family? If you're a parent who wants to protect your children with vaccines, you might soon find yourself facing significantly higher costs or complete loss of access. If you're someone who relies on insurance coverage for vaccines, that coverage could disappear if ACIP stops recommending certain shots. If you're a part of a low-income family that depends on the Vaccines for Children program, that lifeline could be cut. The fundamental question we're facing is this: should vaccine policy be determined by medical experts who have dedicated their careers to understanding immunization science, or by individuals whose primary qualification appears to be their public skepticism of vaccines? And here's the part that should spark serious debate. In an era when measles outbreaks are already occurring and respiratory viruses continue to pose threats, can we afford to gamble with policies that have successfully protected public health for decades? What do you think? Are these appointments a reasonable attempt to bring diverse perspectives to vaccine policy? Or do they represent a dangerous abandonment of scientific expertise in favor of ideological positions? Should parents have more say in these decisions, or should we trust established medical institutions? I'm genuinely curious to hear your thoughts on where the line should be drawn between individual choice and public health protection.